Hello, and welcome to another episode of Dr. Mercola's Cellular Wisdom, where we peer through the lens of health and wellness one tiny cell at a time. I'm Ethan Foster, here once again, always armed with a steady supply of dry humor and a mild curiosity about why every vital thing in our bodies seems to be hidden behind something complicated, like retinas.
And I'm Alara Sky. Good to be here, Ethan. You know, your dry humor is the perfect marinade for these conversations. One day we'll figure out if the marinade's actually healthy, or if it's loaded with vegetable oils, which, as we'll discuss, might be the villain lurking in your kitchen cabinet.
Well, there goes my salad dressing. But today, we're diving into something that sounds quite futuristic, using retinal scans to spot diseases like diabetes and dementia before they start throwing a big party in your body.
It's not every day you hear, "Look me in the eye and I'll tell you if your blood sugar is off." Yet, that's basically what research is suggesting. Our eyes can reveal a lot more about our health than just whether we need new glasses.
Apparently, these scans can detect subtle changes in the retina, tiny problems with blood vessels and nerves, before symptoms show up anywhere else. For some reason, I imagined a high-tech machine beeping ominously like a sci-fi movie. But in real life, it's just a painless, straightforward scan.
It's both science fiction and not science fiction. You're basically getting a sneak peek at your future medical chart through pictures of your eyeball. And it might be simpler than rummaging through various blood tests that you didn't fast properly for because you just had to have that morning coffee.
Let's not talk about how I always cave into coffee. Now, the study we're referencing found a link between retinal changes and multiple conditions: diabetes, dementia, even multiple sclerosis. That's quite the cameo appearance by an organ roughly the size of a small stamp.
The retina is a bit like the control center's outpost. It's connected directly to the brain, and it's packed with blood vessels. It's the only place in the body where you can actually see nerves and blood vessels without surgically opening anything up. So, if a storm is brewing in your vascular system, your retina might tip you off first.
I like the idea of the retina as a secret agent, sneaking out intel about the rest of the body. If it sees suspicious activity, like signs of insulin resistance, it quietly passes the message along to your doctor, presumably wearing a trench coat and sunglasses.
Some retinas do look mysterious under the lens, so you're not too far off. Now, the big news is that artificial intelligence tools can pick up changes in retinal images that humans often miss. I'm all for a second opinion, especially if that second opinion is a supercomputer that never gets tired or needs coffee breaks.
Yes, because humans can get tired. One more reason to up our coffee consumption, though not the best strategy for overall health, perhaps. Now, researchers have used AI to detect microscopic vascular damage, plus neurodegenerative changes, long before a seasoned specialist would see it.
This is valuable for people who might be on the brink of diabetes or have prediabetes. Their retinas show distinct structural changes, which can serve as a major flashing sign. Hey, maybe reconsider how many donuts you have every morning.
That's interesting, because prediabetes can be sneaky. You might feel just fine, going about life, and then your retina is like, psst, you're not so fine. The earlier we catch these issues, the more time there is to do something about it.
Early detection is basically our shot at changing the narrative. And let's not forget, these scans don't just help with diabetes. They're also useful for checking the earliest signs of dementia. If there's early neurodegenerative activity, the retina can show that by thinning or changing in certain layers.
It's as if your eye is saying, we're losing structural integrity around here. Might want to check the old brain too. I imagine it in a cautionary tone. Don't shoot the messenger, the retina would say.
Indeed. And beyond that, they've looked at conditions like multiple sclerosis, where nerve damage is quite central. The retina can reflect that nerve damage because it's an extension of the central nervous system. If your nerves are struggling, your eyes often reveal it.
So, retina plus A, eye equals an early warning system for all sorts of trouble. Now, I've read that the retina might even show signs of vascular disease. People with hypertension can have changes in the little blood vessels in their eyes, which might correlate with bigger issues like heart disease or stroke risk.
Exactly. The bloodstream, like a highway, can have little cracks and potholes in your eye region, which might mean the interstate near your heart is in trouble too. Retinal imaging is basically a window into your vascular highways.
It's comforting and unsettling all at once. You can find out early, but do you really want to know? The correct answer, I believe, is yes. Knowledge is power, especially if it leads you to avoid further damage.
If the alternative is to remain blissfully ignorant until the body decides to throw a crisis party, I'd rather know. Early detection, better interventions. Now, let's shift a bit to what Dr. Mercola's analysis suggests about ways we can protect our eyes and overall health.
Yes, let's talk strategy. We can all do a better job of taking care of the system behind our eyeballs.
Dr. Mercola points out that optimizing carbohydrate intake is crucial if you've got insulin resistance. Now, when I say optimizing carbs, I don't mean finishing off a box of pastries. We're talking about the right kinds and not going excessively high in processed carbs.
Right? So, fewer pastries, more fruits and root vegetables. Got it. I'll put a sticky note on my fridge. But apparently the worst offenders might be those sneaky vegetable oils that we all thought were healthy.
Precisely. According to some, vegetable oils and processed foods can trigger inflammation, which is the last thing you want for your vascular system, or for your retina for that matter. So ditch the high linoleic acid oils, swap them for something less ominous, and maybe your retina will thank you.
My retina just winked in agreement. Another suggestion is daily movement. It doesn't have to be an Ironman triathlon. A brisk walk can do wonders for circulation, which helps keep those retinal blood vessels in a tip-top shape.
Circulation is everything. If you don't want your blood vessels to turn into clogged highways, get that blood pumping regularly. Whether it's a walk, some mild cardio, or even spontaneous kitchen dancing while you're cooking dinner, your retina doesn't judge how you do it as long as the blood is flowing.
That's good news for my interpretive dance moves. The next suggestion is about sunlight. Now, obviously you don't want to fry yourself into a crisp, but apparently moderate sun exposure is key for mitochondrial energy production.
The mitochondria are like the power plants in your cells. If you starve them of what they need, your body struggles. And the retina, ironically, can be an early casualty. The nuance, though, is that if you've been eating a lot of vegetable oils, your skin might be more prone to damage from the sun. So maybe dial back those oils and let your body recover.
So, the game plan. Ditch the vegetable oils, fix your diet, and then enjoy some healthy, gradual sun exposure. That also helps with vitamin D, which is essential for so many bodily processes.
Absolutely. Another interesting point is using methylene blue. It's kind of a cellular booster, if used correctly. Dr. Mercola suggests a small dose can enhance energy production in the mitochondria, but it's not a take more for extra credit scenario. A little can go a long way.
We also have hidden toxins to consider, things like environmental estrogens found in plastics, and more of those dreaded vegetable oils. They're messing with your cellular function on a deeper level, which eventually can show up in your eyes.
This might be the one time in life we're all rooting for glass jars, glass bottles, less plastic. Maybe I'll start stashing my leftovers in fancy glass containers to give my retina a chance at a brighter future.
Exactly. The retina might appreciate it. Then, there's the angle about certain nutrients. For instance, vitamin B6 and some minerals like magnesium and zinc are critical for managing blood sugar. A deficiency in those might set you up for metabolic troubles that eventually appear in your eyes. So, the big takeaway is that the retina is not just there for seeing pretty sunsets. It's a forward scout for metabolic and neurological health. If it's thinning or showing microvascular damage, we might be drifting toward bigger problems.
Exactly. And if you're high risk, maybe you have a family history of diabetes or neurodegenerative issues, getting a retinal scan could be really wise. Asking if there's AI-powered analysis might also be a good idea, because as we said, the AI has a sharper eye for those tiny red flags.
I like imagining a future where you walk into an eye clinic, get a quick scan, and the AI says, well, your retina's healthy, so go enjoy life, but maybe ease off the dessert buffet. Or it says, we see early signs of a problem, let's intervene. It's more proactive than we're used to.
Absolutely. And the earlier we start paying attention to vascular and metabolic signs, the more we can pivot. That's the big plus. The last thing you want is to hear about these diseases once they're already entrenched.
And let's be realistic. Doing these scans doesn't mean you're automatically doomed if there's a slight abnormality. It's a heads up, a chance to step back and say, let's tweak the diet, let's move more, let's soak up a bit of sun and not bathe in canola oil.
Let's also confirm that a big part of health is daily habits. No one can outrun a toxic lifestyle, no matter how many fancy scans you get. The idea is to use the scans as early detection, then fix the underlying causes.
Once you know your cells are in trouble, you do something about it, and hopefully with fewer donuts and more avocados.
Avocados and magnesium. Delicious. Pair that with an evening stroll, some sunlight, and you might keep your retinas and your brain functioning optimally.
And for folks suspicious about AI, it's worth noting that AI can be a tool. It's not here to replace your doc, it's here to help. Think of it as an extra set of eyes, pun intended.
Absolutely. AI is just scanning thousands of images and saying, here's a pattern that correlates with early disease. No emotional baggage, no caffeine cravings, just data-based insights.
So, the next time your optometrist or ophthalmologist says, we can do a retinal scan, remember, this could be more than just checking if you need thicker glasses. It's a peek into your vascular health, your metabolic function, and even your risk of cognitive issues.
And if the results nudge you toward a better lifestyle, your eyes and your entire body will thank you for it. Because those subtle changes in the retina are not just a weird footnote in your medical chart. They can be the key to preventing a host of serious conditions.
Right now, I'm envisioning my retina cheering me on every time I order a salad with extra spinach. Go, Ethan, feed those blood vessels something good.
Exactly. And then, when you skip the vegetable oil-based dressing, your retina probably throws confetti. This might be the only situation where I'm excited about confetti in my eye.
Maybe just metaphorical confetti. Real confetti in the eye would hurt. But yes, the idea is that our bodies respond when we treat them well.
So to recap in a nice, tidy bundle. 1. Retinal scans can detect early signs of diabetes, dementia, and more. 2. AI is stepping in to provide a sharper perspective on these scans. 3. Lifestyle shifts, like better carbs, ditching veggie oils, daily movement, safe sun exposure, possibly methylene blue, and avoiding toxins, are how we keep our eyes and entire system healthy.
And 4. Even though this is called cellular wisdom, the retina might be the star pupil of that classroom, waving its hand to get our attention about bigger health issues. If we ignore it, we risk more serious problems down the road.
Precisely. The retina is the messenger. We should probably listen.
That about wraps it up for this episode of Dr. Mercola's Cellular Wisdom. We hope you all found a new appreciation for that quiet layer of tissue in the back of your eyeball.
And hopefully you got a few laughs. Although, if you're laughing so hard that tears come out of your retina, it might be time to calm down. But by all means, keep that sense of humor. It's a great stress reliever.
Indeed. Thanks for tuning in, everyone. I'm Ethan Foster, reminding you that health isn't rocket science, though it sometimes feels like it.
And I'm Alara Sky, telling you that your eyes might be more honest with you than your mirror. Until next time, take care of those cells, and don't forget to blink every once in a while. Take care.